What I can tell you and what I can advise you is do not look at your positivity rate or your daily cases. You need to look at how many people are really admitted in ICU or high care and what are your death rate for those patients specifically admitted for COVID-19. I am a family practitioner, 33 years, and still old school. I'm not very high on treating patients on electronic platform. So even with the beta wave, with the delta wave, we let the patients come into the surgery. And I think that assists us greatly in understanding how these different variants attack the body. We were out of the delta wave about 8 weeks, and you haven't seen anyone. And this didn't make sense that morning with the complaints that this young man had. And I tested him positive, and subsequently his family also all were positive. And that day I also saw other patients more or less the same type of symptoms. So the symptoms very much different from Delta. And I think at this stage everyone are aware of. For me, I call it musculoskeletal, mostly because of the sore body, backache, headache, chest pain, and then the scratchy throat, might have a slightly running nose. Not really fever, not really any oxygen needs. So in the beginning, when I first saw these patients, I still followed the Delta protocol. Following these patients, in Delta, you have to see your patients back because they tend to turn around about day 10, between day 7 and day 10. That's when they really get bad. But within 1 week, I realized that only of all the patients that I've seen, only 4 came back for their follow-up. The rest phoned us and said, no, they're much better. They're not going to come back. They're not going to waste our time. First of all, you need to look at the definition of the WHO regarding definition of mild illness of COVID-19. And the definition is clear: signs of upper respiratory tract infection, no shortness of breath, dyspnea, or any abnormal chest X-ray. Patients should be able to be treated at home. That's the WHO definition. So if you look at that definition and less than 1% get severe illness, the majority of patients in primary health care are adhering to the definition of mild illness. Any viral infection, if you are unvaccinated, if you have comorbidities, might lead to severe illness, and that severe illness would be a pneumonia. That's what we have seen with Omicron. What I can tell you and what I can advise you is do not look at your positivity rate or your daily cases. You need to look at how many people are really admitted in ICU or high care and what are your death rate for those patients specifically admitted for COVID-19.